Hi, everyone. Welcome back to the Breast Cancer Podcast. Hello, I'm your host, Dr. Deepa Halaharvi, a fellowship trained breast surgeon, and also happen to be a breast cancer survivor, thriver, and a warrior, living my best life. As you know, breast cancer affects millions worldwide, touching lives in a profound ways. Whether you're someone facing a diagnosis or a supporter seeking information or just eager to learn more, this podcast aims to be a beacon of understanding, hope, and empowerment. I'm here to talk about all things breast cancer, from surgery to survivorship, as well as high risk for breast cancer to metastatic breast cancer. My goal is to provide you with reliable information, share inspiring narratives, and foster a supportive community. I know firsthand the challenges breast cancer diagnosis brings. Throughout this podcast, I will give you strategies to handle difficulties that arise from cancer diagnosis. We'll have insightful conversations with medical experts, researchers, survivors, caregivers, and advocates. I will tackle topics that impact our lives as cancer survivors. My goal is to educate you and empower you to live your best life. I definitely have. Well, let's get started. Heart disease is often thought of as something that happens later in life, but for many South Asians, it's happening earlier and often silently. Hi, I'm Dr. Deepa Halaharvi, a breast surgeon and a breast cancer survivor, and your host. Today, we're talking about the topic that is both medically urgent and deeply personal for me: cardiovascular risk in South Asians. I lost my mom to complications of cardiovascular disease and diabetes. And looking back, I often wonder, what did we miss? How did we not know this? And that's why this conversation matters so much to me. It's so personal because if we can raise awareness, we can change the outcomes of other mothers and fathers and sisters and wives. We now know that South Asians are more likely to develop diabetes and heart disease at younger ages when lower body weights and often with fewer obvious warning signs. By the time a heart attack or stroke happens, the risk has been building quietly for years. In this episode, we are going to explore why South Asians carry high risk, what skinny fat means, what does it mean a traditional BMI for European descendants versus South Asians. And I am super excited to have Dr. Mubin Syed with me. He is a nationally recognized physician with 30 years of experience, specializing in endovascular therapy. He's also a health historian and medtech entrepreneur, holding 28 patents. He's the author of a medical guide on pain treatment and healing from our history, how colonial era families led to modern South Asian crisis. His mission is to help South Asians improve their health. It led to TED Talk, and he's featured on a number of news media and podcasts. And I am, for one, extremely excited to talk to him today and extremely excited to learn from him so we can help other South Asians listening to this podcast. Dr. Mubin Syed, thank you so much for taking the time to join us today on this breast cancer podcast. Welcome.
Oh, thank you, Dr. Halaharvi. It's my pleasure and honor to be here, actually.
Thank you so much. And I know you are a South Asian health advocate and a health historian, and I'm just like so fascinated listening to you. I feel like I can't get enough of all the knowledge that you have acquired. And your book is simply fascinating. And I haven't completely finished it yet, but I feel like this is one thing that I'm going to keep reading over and over again.
Oh, thank you.
Can you please share a little bit about your journey and what led you to focus on cardiovascular health, especially in South Asian community?
Yeah, sure. So what I would notice, as maybe many people have noticed, is that it just seemed to be so prevalent. Diabetes, heart disease. I thought, is this normal? I mean, why are so many people getting this, in our community? It just seemed almost the norm.
Yeah, yeah.
And especially, people, even younger people were getting it relatively in their 40s. And even I've started noticing in the 30s, why is this happening?
You're
And
right.
then at first I thought, well, maybe it's because they're just not healthy.
Hmm.
Maybe they're just less healthy than they should be, and they're not following normal patterns of eating that they should be. And I would kind of sort of attribute it to their lack of health awareness, with poor health habits. And I thought, well, I'm kind of relatively health conscious. I'm going to be okay as long as I'm careful and, perhaps not doing what I thought these other
Yeah.
people experiencing these health issues were doing. Um, and that was, how I kind of was thinking until I had my heart attack.
Yeah.
Out of the blue, I had a very serious STEMI, which is the worst kind of heart attack.
Yeah.
Um, and I actually couldn't even believe that I was having the heart attack. In fact, I didn't even have the normal symptoms. I could not believe. I actually went to the emergency room, and even there, it wasn't. I couldn't believe that my EKG was showing an MI.
Yeah.
It just was too hard to believe. I couldn't accept it, and so I actually had urgent stenting done. Had 3 stents put in, and I felt immediately felt better. Thankfully, I didn't have any myocardial or heart muscle damage because it was caught so early. I had some very good treatment, by excellent interventional cardiology people. But the experience kind of really forced me to realize that it's not just lifestyle,
Right.
not just, your diet. There's got to be something else. If someone who's relatively, like I consider myself relatively health conscious, there's
Right.
either something I don't know,
Yeah.
or maybe there's other factors at work that are not known that people aren't talking about.
Yeah.
And that's when I really started to do a deep dive because it was basically it was mind blowing to me. And I wanted to know everything I could possibly learn about cardiovascular disease, and
Yeah.
especially in South Asians, more for not just for my, for educating other people, but just for myself. I wanted to
Right.
know what can I do
Right.
to change this trajectory because it was kind of scary. I mean, I had an elevated lipoprotein A. Mine
Yeah.
was kind of sky high.
Wow.
And the prognosis you would think would be actually very poor for that.
Yeah.
And so I was kind of scared, but as I learned more about this, I started realizing that South Asian physiology is different.
Right.
And this physiology is sort of under-recognized,
Yeah.
even by most mainstream, health that's mainstream medicine that's practiced
Right.
in most Western countries, and even perhaps I would say, in South Asian countries where
Yeah.
it's based on Western models of medicine.
Right. Right.
Even these studies are based on Western. The subjects of these studies that the research is based on is, I would have to say, exclusively white people,
Right. Right. Right.
Caucasians or European people. And it kind of tragically underserves us
Right.
as a people, especially because we have such high rates. We have one of the highest rates of I mean, our
Yeah.
risk of heart disease is like 4 times higher risk of diabetes, again, same range, 4 times higher than the standard, Caucasian population that where we may be living in. And
Yeah.
it was just that's really what kind of led me to realize that it's more than just ourselves. And that's when I sort of did the deep dive and I came up with, well, perhaps it's the history, the epigenetic effect that could be a factor. Of course, lifestyle is a major component.
Yeah.
Um, but I think our physiology is unique, and maybe the reason for that perhaps is due to our unique history,
Yeah.
particularly the colonial famines, the
Yeah.
genetic effects of that. And it made sense to me.
Yeah. For our audience who is, this podcast goes to 147 countries. And so for our audience who are not in medicine, how can you explain the epigenetics?
Yes. Epigenetics is, you can think of it, our genes, of course, are
Yeah.
what you can think of it as the writing, And but how our genes are interpreted,
Yeah.
perhaps, is what you would call epigenetics.
Yeah.
Someone may have the same genes as someone else, but there may be slight changes in pronunciation or punctuation
Yeah.
that cause the same sentence to be interpreted differently.
Yeah.
And so our genes are kind of flexible in that they allow that to happen. And
Right.
frankly, it's a survival mechanism.
Right.
And actually, in our situation, I believe in South Asians, there is an epigenetic effect uh, because in other populations, there's a similar epigenetic effect from surviving famines. People may not realize this, but during the colonial period and throughout, South Asian history, but especially during the colonial period, there were major pervasive consecutive famines that is like it's a huge spike compared to, before and after
Yeah.
um,
Yeah.
colonialization.
Yeah.
And I hope I'm, basically answering your question, but that's the
Yeah.
difference.
Yeah. So I feel like with the epigenetics, there is not a whole lot of control that we have. I mean, obviously, the lifestyle factors. I was born in India, but moving here, obviously, my lifestyle is so much different than the lifestyle that would be back home, right? But
Hmm.
I also consider myself to be healthy and working out. And when I saw some of the statistics on how much we need to work out as South Asians, I was kind of surprised. I had no idea. Everything
Yeah.
that you're talking about, I had no idea. And I felt like, gosh, like I went to medical school and I'm talking to all these, I'm surrounded by people that are so smart and even taking care of my mom. Like my mom was this skinny Indian lady who was diabetic and had complications of diabetes.
Hmm.
And of course, she loved the white rice. She grew up with the white rice. For majority of my
Yeah.
life, I ate white rice because you just grow up in the same household.
Yeah. By the way, it's an introduced food.
That's what I read and heard.
During the colonial period, I
Yeah,
mean, South Asians did not eat white rice before it was introduced.
yeah,
This polished version of white rice is foreign to our diet.
yeah,
And yet, of course, we have adopted it and we eat it in large quantities, perhaps even more than any other people on earth, by the way,
yeah. And
capita.
there is no nutrition, correct, in the white
Yes, it's
rice? Yeah,
very poor in nutrition. It's
yeah,
basically like eating sugar,
yeah,
sadly. I mean,
right.
I would say there are other forms of grains that could be better for us.
Yeah,
It doesn't have to be white rice. It could be, brown rice is definitely
yeah,
better,
yeah,
millets, etc.
right. Yeah, I was very surprised that how rich we were agriculturally. Just reading your book, I mean, I just learned so much, and
Yeah.
I don't know why that was not taught or why we don't talk about it. Like, for instance, I'm a breast cancer surgeon. I'm also a breast cancer survivor, but we talk about breast cancer so often. It's all over the media. You read about it everywhere. There's so many guidelines. And for the
Hmm.
cardiovascular disease for the South Asians, I have often wondered there was a disconnect in my own mind and how a person that looks really skinny on the outside now has this really terrible metabolic syndrome, so to speak,
Yeah.
whether it's increased lipids or heart attack or something else, as a result of that. And you hear this term skinny fat in South Asians. What does that mean exactly?
Yeah. Skinny fat is when someone can have like a normal weight,
Yeah,
look healthy on the outside, and still be at very high risk for diabetes and heart disease. And it's basically because um, South Asian bodies are different, and physiologically, we tend to store fat in a different way. Instead of storing it more superficially, like on the outside, we tend to store it in between our organs,
yeah,
even inside the organs, like the liver,
yeah,
called visceral fat. And this is unfortunately a very toxic form of storing fat.
yeah,
And it can really cause a lot of metabolic problems. It's a dysfunctional way of storing it.
yeah,
Um, and I mean, I always theorize as to why our bodies develop this way, but I think perhaps because they're starvation adapted,
yeah,
there wasn't much fat to store to begin
right,
with.
right,
And then when they had to store it, it was stored in the wrong way.
yeah,
And that, of course, has this secondary side effects in a time of abundance. This is when this becomes a problem, when we're storing, relatively large amounts of fat, when
yeah,
our bodies are not used to,
yeah, yeah.
abundance.
Yeah. So, what are some signs for South Asians or early warning signs that people should be looking out for?
Yes, that's a really good question. I would say that in my case, I didn't have any early warning signs.
Yeah.
So I want to say from the outset that just because you don't have any symptoms, it doesn't mean you're healthy.
Right. Right. I agree.
You could actually have a significant risk for heart disease and diabetes even, and not even realize it being South Asian because you would look relatively healthy. I mean, you would look thin. Um, and but I think screening is crucial for that
Yeah.
reason. Like you
Yeah.
should be getting screened for all the different things that we'll be talking about later, especially if, particularly if you're South Asian. But at the same time, I'll talk about the symptoms that you could experience if you're at risk for heart disease. Number one could be shortness of breath, um, or chest tightness associated with exercise. Perhaps even you're noticing that your endurance is lower. Perhaps you could climb a few flights of stairs before, and now you're struggling to climb even one flight of stairs. That's a sign that something could be wrong.
Yeah.
Uh, you, uh, I mean, that's the major symptom I would say to know that something is wrong. I mean, of course, if you're having episodes of sweatiness
Yeah.
with exertion much more than with relatively smaller amounts of exertion than you used to be
Yeah.
experiencing these symptoms. That's the change that's important here.
Right. Okay. And we are taught in medical school, I'm taught like BMI over 25 is
Of course, I'm
considered.
sorry, one more thing, like swelling in
Yes.
your lower extremities could be a
Yes.
sign also,
Okay.
by the way.
Okay. Thank you for that.
Mhm.
And just looking at the BMI, and in America, like BMI
Oh, and
for
I forgot
women,
one more thing. Sorry.
that's
Shortness of
okay.
breath that wakes you up in the middle of the night.
Okay.
That's another key thing that, you know,
Okay. So to summarize, shortness of the breath, like getting out of
or
bed,
requires you to sleep on multiple pillows at night, for
where
instance.
you're propping yourself up on multiple
Yeah, those
pillows.
are
Okay.
signs of kind of like some advanced form of heart disease that needs to be checked out.
Okay. Okay. So someone that looks healthy and skinny, that doesn't mean that they don't have heart disease, correct? That's like
Correct.
they
That's a
will.
sad part about this. It's
Yeah.
it's like it's symptomless.
Yeah.
Your first symptom may be a serious heart attack that could even be life-threatening.
Yeah. I'm so glad that yours wasn't, and you're here to tell your story and to help so many
Yes.
people. It's really scary. It really is very scary to hear all this.
I mean, there was I mean, even in the emergency room, there was a story recently of a South Asian gentleman, 44 years old, who showed up to the emergency room with symptoms, severe chest pain, by the way. He did not get properly diagnosed. I think his EKG may have been normal, and he
Yeah.
was dismissed as not having anything serious, and he ended up dying in the emergency room.
Oh, wow. That's really sad.
Yeah,
That's really sad. So I think what you're saying is it's important for us to be educated to recognize these signs and symptoms in people.
yeah. And there should be a high clinical suspicion amongst
Yeah.
physicians who treat South Asians, by the way.
Yeah. I'm like really surprised as why this is not taught in medical schools. One out of four people in the world are South Asians, correct?
Yes, that's what's so sad.
Yeah.
We're completely underrepresented in the studies about heart disease.
Yeah.
And like the Framingham risk score based entirely on, I mean, zero South Asian representation.
Yeah.
It's based on white males predominantly. Even the
Yeah.
World Health Organization came up with a risk stratification score for heart disease, and majority were from Europe. Of the
Yeah.
participants, 23% were from North America, and the rest were from Japan and Australia. Even though South Asians have the majority of heart disease in the world,
Yeah.
60% of the cardiovascular disease burden is borne by South Asians,
Oh,
even
wow.
though we're 25% of the world population.
Oh, wow. That is a huge number. 60% is a huge number for a
Yeah.
quarter of the population.
Hmm.
So that leads me into talking about BMI, right? In America, we talk
Yeah.
about this, for instance, for in breast cancer surgery, there's a certain BMI for which they cannot get reconstructive surgery after a mastectomy, just because
Hmm.
of the risk of complications and so on and so forth. And in my mind, I always thought BMI of some BMI of 23, which I think, according to South Asian, that's considered overweight, I believe, right?
No, no,
Because-
23 is actually good. It's actually
Okay.
excellent. And you probably start to have risk as your BMI increases above that amount.
Yeah.
But that isn't actually a relatively ideal BMI.
Yeah, I do a pretty heavy strength training, and so I attribute
Excellent.
I attribute that to that. So hopefully, most of that is muscle. But I know in America we say the cutoff for BMI for being overweight is 25. For South Asians, is that any different, or is that
Yes, that's a very interesting and good question. So it's BMI sort of underserves us as a
right?
community. We can have, once our BMI's in the 25 range, actually, in some people would actually say we're actually obese at that point.
Right,
Certainly 27.5, we would be considered obese. For someone who's of Caucasian heritage, the um, it would be closer to 30 to be considered obese. 25 would be actually in the upper limit of normal range. But for someone who's 25 and South Asian, we would be considered overweight,
oh wow,
even potentially obese range. But I think
obese.
it's closer to 27.5 now for South Asians. But
Okay,
23 is kind of like the ideal cutoff for
okay,
what you would want to maintain it at.
okay,
And yet it still underserves us because you can have a BMI even lower than that
yeah,
and still have large amounts of abdominal or truncal obesity
right,
because we store fat, as we mentioned, in the between our organs,
right,
inside our abdomen, and we tend to have low amounts of lean muscle mass compared to other ethnicities.
yeah,
Um, and as a result, BMI can actually be misleading for
yeah,
South Asian. Again, you can look like you're healthy, but you're
right,
not. Waist circumference may actually be a more accurate way of measuring, how much fat you're storing,
okay.
even
That
if you have a normal BMI.
Yeah, so that was going to be my next question is, are there some things, what should one pay attention to instead of weight on the scale, like waist size,
Mhm.
labs, so on and so forth. So what
Yeah,
should,
so that's a good question. It's actually for males, it's 90 centimeters.
okay,
And I think it's like 30. I always forget the exact number here. I'm trying to actually look and see here. It's basically 85 centimeters for women, uh, of South Asian heritage, and 90 centimeters actually, sorry, 80 centimeters for women,
okay,
90 centimeters for men. It should
okay,
be at or below, that.
okay,
And if it starts to become more than that, then you may, you start developing metabolic risk at that point.
okay,
So it's a key thing. And that translates roughly to about 31.5 inches for men. And I'm trying to remember, actually 35 inches for men and 31.5 inches for women.
for women, okay, okay.
Yep.
So this is the thing. I deal with breast cancer patients who are unfortunately postmenopausal in their
Mhm.
30s and 40s because part of the treatment for breast cancer is to remove ovaries or giving medication that puts them in medical menopause or sometimes surgical menopause. That's just part of treatment of breast cancer. When you're talking about truncal obesity or obesity around in the abdomen, the waist circumference, it's so hard for postmenopausal women, let alone lose weight, but also, the obesity around. And so I imagine the measurements are the same regardless of what age you are, correct? It doesn't matter.
Yeah, surprisingly. I mean, I guess it's more for adult people, of
Right,
course.
right, right.
Yeah.
Um, so what if there is a South Asian listening to this podcast? What are some things that you would tell them for a look out for? Like, family history, we talked about that. I mean, and
Yeah.
things
Family
they gotta
history,
consider.
waist size, and also it's not just your weight on the scale.
Yeah.
It's your labs. I would say for South Asians, to keep it simple, your labs and your waist size are more important than your weight.
Okay.
So things that you could, so these are a few key markers.
Yeah.
Waist size, central fat is a strong predictor of risk for heart disease, diabetes, metabolic risk, we call it. Um, check your blood sugar, even if you're not having symptoms. Hemoglobin A1C, fasting glucose, and even fasting insulin,
Yeah.
because this may actually predict if you're at risk for prediabetes,
Okay.
the fasting insulin level, and even, of course, hemoglobin A1C and fasting glucose. They can all predict it. Even if you're not frankly diabetic, you're at risk even if you're pre-diabetic. And by the
Mhm.
way, if your hemoglobin A1C is above a certain level, namely like 5.7, and you're having
Yeah.
symptoms, especially, or maybe a strong family history, you should probably get an oral glucose tolerance test to make sure that you're not
Okay.
overtly diabetic,
Okay.
especially if you're South Asian. Um, Fasting insulin, we mentioned, get your triglycerides levels and your HDL level checked out. It's a good window into your metabolic health. Specifically, get what's called your ApoB level.
Okay.
Because LDL is not a really good test for South Asians because we tend to have smaller particles that are more atherogenic. It's not necessarily captured by the LDL level.
Hmm.
So the ApoB is actually much more accurate. It's probably the most important lipid test
Okay.
you can get,
Okay.
specific for South Asians. Also get the lipoprotein small a level.
Okay.
That is this is one of the biggest risks for cardiovascular disease.
Yeah.
And this is actually overrepresented in South Asian
Okay.
people.
Okay.
Um, Check your high sensitivity CRP level. This is a marker of inflammation. Again, it puts you at risk if it's elevated. Check your liver health, meaning you should get screened for fatty liver. Um, when appropriate, based on your risk factors, you may consider getting a coronary calcium score,
Okay.
or even a CT angiogram, a coronary CT angiogram.
Okay.
Uh,
What age would
Depending
you
on your
recommend getting the labs and getting starting to get screened?
Yes, and so we're kind of like working on this, but I would say certainly when you're in your 30s, you should
Okay.
probably get this
Okay.
checked out, and perhaps even sooner if for diabetes,
Okay.
um, screening for blood sugar, et cetera. And certainly if you have a strong family history, if you have hyperlipidemia, or of course if you have symptoms.
Yeah. And what are some things people can do when they do have high lipids or at risk for developing heart disease or have had heart disease? What are some things people can
Yeah.
do?
So you probably need to see a physician about this,
Yeah.
perhaps even a specialist,
Yeah.
and get your risk because you can alter your risk trajectory.
Okay.
It's not inevitable.
Okay.
Even with our particularly high risk for heart disease and diabetes, you can modify this. This is a modifiable risk.
Okay.
If you know it early enough, that's when you can make the most difference
Okay.
in you have to be extra careful with everything. You can't do what everyone else around you is doing.
Yeah.
Uh, and I think you just have to be careful with your diet. You have to be
Yeah.
careful with getting enough exercise,
Yeah.
sleep, maintain,
Yeah.
I should say managing stress,
Yeah.
the usual things, but you just have to be extra vigilant, I would say.
Yeah.
And by diet, I mean, really restrict your refined carbs in your
Right.
diet, avoiding, unhealthy foods like processed foods,
Hmm.
fatty foods, fast food. Those can be very bad for our bodies. I mean,
Okay.
sugar,
Right.
even. You don't want to overindulge in these things.
Yeah. How about exercise? I know in breast cancer world we say,
Mhm.
30 minutes a day, half an hour a day, 30 minutes a day, 5 days a week is what we say, 150 minutes,
Yeah.
which it sounds like may not be enough for South Asians, correct?
Yes, there's been some studies that have shown that the numbers are closer to 232 to 266 minutes of
Yeah.
moderate intensity exercise per week, rather than the 150 minutes that's traditionally prescribed
Yeah.
for most people.
Yeah.
Uh, it seems like to maintain the same degree of cardiovascular or cardiometabolic health,
Yeah.
you need to actually be more active.
Yeah.
Uh, and paradoxically, South Asians, there's been many studies that have shown this, that South Asians are the least active ethnic
Yeah.
group.
I
In yes.
I see that in my practice. Actually,
Mhm.
I mean, like I think I want to say 70% of the people that I see do not get 150 minutes of exercise per
Yes.
week. And so,
You
yeah,
really have to make an effort. And you're
right,
right. It's so paradoxical. We're, as a group, I'm not saying, of course, there's many people who are quite
right,
active.
right,
In general, South Asians as a group are much less active.
right,
Yet
right.
we need more exercise than everyone else.
Right, right. And we should also make sure eating those foods that are not full of sugar, which is white rice is sugar,
Yes.
those rotis, paradas.
Hmm.
You go to like some gatherings and there's all these sweets and,
Yeah.
appetizers, lots of sugar.
Right.
Um,
I mean, one thing
yeah.
that I could even suggest is there are over-the-counter glucose monitors.
Okay.
If you want to check it, maybe even temporarily,
Yeah.
you can get this, you can order this over the counter now.
Yeah.
You would be so surprised
Yeah.
as how high your blood sugar may go.
Yeah. Is it
And
the
of course, this
continuous glucose monitoring? That's what you
continuous glucose monitors, they're pretty much painless to put on your skin.
Yeah.
It takes like a second to apply it, and
Yeah.
it monitors you continuously, even if you're not diabetic. I mean, I'm just saying it may
Yeah.
be very interesting or eye-opening
Yeah.
for someone who's concerned about their health,
Yeah.
uh, to, to try it for even a few weeks and see what happens when they
Yeah.
eat foods that they think are healthy for them.
Yeah. Like yourself, like you're, doing interventional cardiology, radiology, and you're, survived breast cancer. I'm a breast surgeon with breast cancer. So since I've been diagnosed about 11 years ago now, I've changed my diet,
Hmm.
exercise more.
Yeah,
Obviously, I mean, as physicians, it's hard to get enough sleep. I get up early
right,
in
it
the
is.
morning, go to work out at 4:30 and get my workout in before I go to work at 6:30, and I don't get home till 6:37. So even that, I feel like it's not enough because I do a lot of strength training at like a CrossFit
Mhm.
place, but I don't get the steps. So to get the steps when I come back home, I have to do either walking or something. We have walking pads.
Yeah, yeah.
So
It's
it's like
kind of a
it's like a full-time job
it's
almost.
a full-time job. It's
Yeah,
a prescription. I mean,
yeah, yeah,
and I say this to people,
yeah.
exercise is not a choice.
Right, exactly. Yeah,
You really have to incorporate it as part of your life.
yeah,
As much as you have to eat, you need to exercise.
yeah. I know, and I think that's something it's not been taught for us in residency and fellowship. And
Mhm.
I mean, I've seen my mentors, they never take vacation, always work and don't sleep.
Yeah,
Like so, you just think
right.
in order to be a good surgeon, that's what you do. So you just develop these bad habits, I think,
Yeah,
over time,
it's
and
unfortunate. I mean, we
it's
kind
hard
of
to break. Yeah.
sacrifice our career for our
Yeah.
health.
Yeah. I actually, when train a breast surgery fellow and we have residents, when there's residents, I make a point to eat lunch. Usually I don't ever eat lunch because I never have time, but I do it so that they have this impression that in order to provide good care, you should eat lunch, pack a salad or
Yeah,
something like that. But I think those are all the lessons from our mentors that got passed down to us. Some
yeah,
of them are not very good. So, obviously, I take care of breast cancer patients, taking endocrine therapy like tamoxifen, aromatase inhibitors, things like that. They're already at a higher risk for heart disease. Is there anything you would recommend in this breast cancer population to decrease the risk of cardiovascular disease?
Um, so, there are patients who are higher risk from a heart standpoint, you know, who are breast cancer patients or any type of cancer patients. If you have someone with, or if someone has pre-existing diabetes, pre-diabetes or metabolic syndrome, of course, they're at higher risk. Strong family history, um, or particularly of strong family history of early heart disease. That's what
Yeah.
we're talking about.
Yeah.
Women who have central obesity or low muscle mass, people who've received left-sided chest radiation, because that, of course, affects the heart.
Yeah. Right.
People on long-term endocrine therapy, um, and older patients, of course, but even younger South Asian women may be at elevated risk,
Yeah.
which I'm sure you see a lot of. So
Right.
it's not just age, it's really your metabolic background plus your treatment exposure.
Right. Right. And in the breast cancer world too, like women are worried that they're going to die of breast cancer. The most common cause of death for them is heart disease and not breast cancer, assuming they're getting the recommended treatment for breast cancer. So I
Hmm.
always tell women, first thing they want to know is, am I dying? Like I counseled maybe 4 or 5 new cancers today. And the first question is, am I going to live? And I'm like, yes, you're going to live as long as you follow the recommended treatment for this. But remember,
Yeah.
the most common cause of death for us women is heart disease, whether you're Caucasian or South Asian, or it doesn't matter. I think, and that's something
That's
again.
such a good point. I mean, it's
Yeah.
so important. I mean, it's for
Yeah.
South Asians, I think I'm with you. Cardiovascular prevention isn't optional. It has to
Right.
be built into the care from day one for cancer
Right.
patient.
Right.
Yeah.
Right. Absolutely. And how has this working in this space changed for you and how you think about prevention for yourself, for your family, for your community? I'm sure you made such a huge difference in I mean, I see what you're doing on Instagram, and you go by Desi Doc on Instagram. And I went through some of your posts, so educational, so informational, so
Thank you.
inspirational. I mean, honestly,
I just hope it makes a difference in people's
yeah,
lives because I mean, I just don't want what happened to me.
yeah,
And as a physician, surprisingly, it happened to me. I mean, you can imagine how much it affects people who are not physicians,
right, right, exactly. I
who
know,
don't have
and
specific knowledge.
right, exactly. And I know, I mean, losing my mom, and I feel bad now. So I had moved her into my home to take care of her, and she was
Hmm.
experiencing side, and she didn't want to move in with us much sooner. And I think part of the reason was she didn't want us to restrict what she would eat and things like that. And it's
Hmm.
really hard to change your habits of what you're used to for 70 years of your life. Like, and so that heart disease and the complications started 10, 20 years earlier. She also took care of my dad, who had a stroke for several years,
Oh man,
neglecting
wow.
her own self, which, what a lot
Hmm.
of women do. So, I feel terrible. Like I didn't recognize those symptoms 20 years earlier, because that's when I think prevention should have started, not the 9 months before I brought
Yeah,
her to my home. It was too late by then. And like you're surprised that you didn't recognize that in yourself. I am very shocked and um sad that I wish I had done a better job for my mom. And I want this episode
that's how
to,
I feel also
yeah,
for my
yeah,
specifically for my mom as well.
yeah,
I feel like it's sad, but the guidelines are based on European or
yeah,
people populations derived from Europe, such as in America or Canada or
yeah,
Australia. They don't fully account for the earlier risk that people of South Asian heritage experience both for diabetes and also for heart disease and at lower BMIs, by the way.
yeah,
Secondly, screening is off. We wait too long before we find out too late.
yeah,
Um, by the time A1C or cholesterol crosses a threshold, the process in South Asians has already been building for
yeah,
years,
yeah,
maybe decades even. And then the other problem is communication. I mean, I think unfortunately South Asian patients are reassured by their physician too easily. Say your numbers are normal
yeah,
without context.
yeah,
That can delay prevention.
yeah,
And especially South Asians where normal may not necessarily mean low risk.
right. That is so powerful what you just said.
Oh, thanks, thanks.
Yeah, I mean, normal does not mean that you're not at risk for getting not breast cancer, because that's what I talk about all day. I mean, heart disease.
Yeah.
And so,
I mean, it's just based on, my own experience. I mean,
yeah,
my heart attack, it was a major heart attack at age 52. It was
right.
such a turning point for me. It made me realize that you can do many things right,
Yeah,
but still miss the underlying risk.
yeah,
If you're not looking in the right way, I mean, it shifted my focus from reacting to disease to try to prevent or identify risk much earlier for people around me.
yeah,
Um, I think it's more in terms of a trajectory rather than, like thresholds. It's not numbers. If you look at trends, you look at body composition, family history, metabolic patterns are much more important than waiting for something to become abnormal.
yeah,
Um, and it made me personally more intentional for things like strength training, like we talked
yeah,
about. I mean, I
yeah,
also participate in that, or I actively engage in that. I monitor my own labs more closely. Sometimes I make sure, my physicians order these tests for me.
yeah, yeah,
And I make sure that I have conversations with my family. because for South Asians, prevention has to start earlier and has to be much more proactive. I mean,
Right.
you have to be actively engaged in your own health.
Yeah. You have to advocate
Um,
for yourself.
yeah, because you can't rely on the usual signals to warn us in time.
Right, right. Yeah. You have to advocate for yourself, and that starts with empowering and educating yourself, you know,
Hmm.
from people like you who are, taking time out of your busy day and busy life to educate us. And it's very inspiring and,
Thank you. It's my mission. I mean, I
yeah,
just I feel really deeply that there's something that has to drastically change for us
right,
as a people.
right, right. Anything else you want our viewers to take from this episode?
Um, again, I was just surprised when this happened to me that I had
Yeah,
my own heart attack. It's I never thought of myself as unhealthy, but I thought I was exercising. My weight was so close to normal. By conventional standards, I didn't fit a high risk profile. And I
right,
just thought
right.
this would be important for listeners to realize this. That experience of having the heart attack
Yeah,
completely changed my experience of what I now interpret as normal for South Asian,
yeah,
South Asian person. It made me realize that for South Asians, a normal BMI or even at least seemingly acceptable labs can sometimes give you a false sense of security,
yeah,
uh, even if risk is building quietly for many years. Um, and I think we just have to be proactive, like you're saying. You have to look deeper than how you appear from the outside.
yeah, yeah, exactly. And I think that's such great advice. And
I
um,
mean, the key thing is you're not low risk just because you look healthy.
look healthy or look skinny. Yeah,
Yeah. And it's the other good part about this is that your risk and this is what gives us all hope, is that your risk is modifiable.
yeah,
Like you can change your trajectory. You're not doomed, in
yeah,
other words.
yeah,
A lot of people think, oh, this is so terrible. But I mean, I'm a case history of this. You can,
right.
even if your numbers are really abnormal,
Yeah,
you can change it. And if you make the difference even after the event, you can be relatively, you can be a survivor.
yeah,
You can have a healthy, productive life,
yeah,
active life. Um, and I think the key thing is it is happening. I think there is growing awareness now amongst the South Asian community. I think South Asians are asking, better questions to their physicians,
yeah,
seeking earlier testing. They do understand that it's not just your health is not just about your weight or your appearance.
yeah,
Uh, and I think if we align prevention with our biology instead of just applying the one size fits all advice that we tend
yeah,
to hear,
yeah,
we can make meaningful progress you know, for us,
yeah.
not just for individuals, but entire families and
Right,
communities, future
right,
generations.
right, right. Yeah, I always say knowledge is power, and
Exactly.
yeah, knowledge is power, and you want to empower yourself. When you're empowered, then you share that knowledge with others to
Hmm.
empower others. And heart disease and diabetes took my mom far too soon. My hope is that this conversation like this, even if it helps one family to catch the risk early or ask better questions, choose a different path. Anything else, Dr. Syed, that you want to leave? I'm actually really curious about what do you eat? What's your week like? What do you eat for breakfast,
Um,
lunch, and dinner? Or do you even eat
yeah,
breakfast?
so I
Yeah.
generally, I mean, sometimes I eat breakfast, but I don't necessarily eat the standard breakfast. I might have vegetables for breakfast,
Yeah.
just to make sure I get enough fiber in for the
Yeah.
day. Uh, it I'm trying to make sure I get enough fiber by actively eating, you know, vegetables that I prepare or at least prepared in the family.
Yeah.
Not to overcook your vegetables also.
Okay.
I usually try to steam them or uh, microwave them
Yeah. Yeah.
so that they may be cooked. And then I try to eat a lot of salads, which
Okay.
of course is raw vegetables
Right. Right.
on a daily basis. And I what else do I do?
Do you eat meat?
Yes, I do eat meat. I'm trying not to go. too heavy with it, but yes,
Yeah.
I think it's better not to eat too much meat,
Yeah.
I would say.
What's your biggest
Um,
source of protein? Where are you getting protein from?
yeah, surprisingly, I eat fish. Some
Okay.
like every day I try to have some like
Okay.
tuna
Okay.
or what else? I like sardines. I know a lot of people don't like that, but I mean, I enjoy tinned fish.
Yeah.
And I do like, I mean, of course, I eat chicken and I
Yeah.
do eat some red meat, but I'm trying to not have too
Okay.
much of that.
Okay.
Preferentially chicken or fish over that if
Okay.
possible. And what else can I say? Trying to reduce my portions of white rice, in
Mm.
particular, sugary foods. I mean, I try to avoid desserts almost most of the time.
Okay.
Um, and the other thing is, when if you were to check what happens when you eat dessert or white rice, you would
Yeah.
be surprised, even if you're not diabetic, what happens to your blood sugar.
Yeah.
Um, and at the same time, you can see what happens to your blood sugar when you exercise. It actually
Yeah.
comes down very nicely, especially
Yeah.
with uh, in brisk walking or resistance type exercises, climbing
Yeah.
the stairs
Yeah.
even is included in that, or um, you know, doing squats, for instance.
Yeah. How many
Uh,
squats do you do those every day after a meal? I heard that on a
yes,
podcast
it
you
talked
talked about.
works
Yeah.
surprisingly. It
Yeah.
does work.
Yeah.
If you kind of like not eating the best meal and your blood sugar's
Yeah.
climbing above, the 140s or something like that, I would actually, I've noticed that you can do a series of 10 squats,
Yeah.
then followed by 10 calf raises,
Oh, wow. Okay.
followed by 10 wall push-ups.
Okay.
And you repeat that 3 times.
Okay.
And within maybe several minutes,
The blood
10 to
sugar goes
15
down.
minutes, your blood sugar will respond to that.
Oh, wow. Yeah.
And it's kind of nice to see that actually.
Yeah. The problem is I come home late and I'll have my dinner late and I'm so exhausted. I
Yeah,
have
it's
this,
hard, I know.
it's like, okay, I know I need to walk for 30 minutes after eating, but,
Hmm.
and I try to do at
And it
home.
doesn't have to be 30 minutes, even
Yeah.
you can
20
do the
minutes,
20
15.
minutes. You can even climb stairs to get a little bit higher push,
Yeah.
to
Yeah.
that. And of course, these resistance exercises, if you don't have time, you could try these instead,
Yeah.
even
I'm,
shorter.
yeah, I'm going to try that. That sounds like it's doable kind of a thing.
Mhm.
So anything
Yeah.
else that you want to share that I haven't asked you? Any
Well,
questions?
I did have like some common myths that I
Yeah,
could
that
talk.
would be great. Yes, that would.
Um,
I wanted to make sure not take too much of your time, but if you have
no,
time,
no, it's
oh,
it's my
yes,
pleasure.
yes.
So some myth busts we talked. First of all, one of the myths is I'm not overweight, so I must be healthy if I'm
Oh,
South Asian.
yeah, right,
It's
right.
seen. I mean, you hear this over and
Yeah,
over in the
yeah,
South Asian community. The key thing here is that many South Asians may develop metabolic risk at a lower body weight
yeah,
than other people. So relying simply on how you look can be misleading. We talked about that kind of
yeah,
earlier.
yeah.
Second myth, I don't eat meat, so I'm protected.
Oh, that's right. Yeah, I hear that.
Yeah.
Okay, yeah,
So vegetarian diets can still be high in refined carbs,
yeah,
can be low in protein. I mean, sugar, fried foods can
yeah,
even vegetarian diet that can worsen your insulin resistance
yeah,
if it's not balanced properly. A third myth that may be common or prevalent in people, maybe that heart disease runs in my family. So there's nothing I can do.
Oh, okay.
Yeah.
Yeah. I mean, that's
And
me. That's me. I
yeah,
mean, I
so
mean, I am doing something about it, but heart disease run in my family
yeah,
from my
but the
mother.
key thing is you can
Yeah,
do something about it.
yeah, yeah.
Family history matters, but it's not destiny.
Okay. I like that.
Risk can be significantly modified with the right habits and early screening.
Yeah,
Um, and that would be some major myths. I mean, I wish I could erase these misconceptions from
yeah,
people.
yeah,
Um, and then the other dangerous misconception is that heart disease gives clear warning signs.
yeah,
In South Asians, it develops silently over years.
yeah,
People feel fine, look fine, and then present with a major event like a heart attack.
yeah,
Um, that's why waiting for symptoms is so risky.
yeah.
For South Asians, prevention has to start with earlier with awareness, screening, and proactive changes rather than reacting after something happens.
Yeah. So
And
again,
then, sorry,
be empowered with this knowledge that you're giving us. I mean, these are all really
exactly.
great tips. So starting at age
The other
35.
thing I would say, there's a myth going around that we're kind of doomed because we have small coronary arteries.
Yeah, tell
Have
me
you heard
about
this?
that. Tell me that
Yeah.
about that. Is that true or not true? That
So
you have
it's
smaller
not
coronary.
true.
Okay.
I've talked to a couple experts about it, and there was an article recently in the Canadian Journal of Cardiology that came out last year, or
Okay.
2024, I should say,
Okay.
and they kind of busted this myth.
Okay.
It's based on studies that were done on people with advanced coronary artery disease, and you look at anyone's coronary artery disease, if because as we mentioned, South Asians develop diabetes and coronary artery disease 10 years earlier than the general population. So when you look at someone's coronary arteries, when they have disease, they got a 10-year head start than other people.
Right, right.
Arteries are going to appear smaller.
I
It's
see.
because of diffuse disease.
Okay.
And also number two, a lot of South Asians tend to be smaller.
Yeah, right.
So if you count for body surface area, it's actually, and if you do it in someone with healthy arteries, the arteries are actually the normal size for that. They're proportionately the right
Oh,
size.
okay. That makes sense.
Yeah, so that's
Yeah.
another thing
Yeah.
that I would say could be misconstrued.
Yeah.
I think, and I talked to Dr. Enos, who you may or may not be familiar. He's a big. He said, yeah, that's really where there's erroneous myth
Okay.
is
Okay.
started from.
Okay. I
And
did
so,
hear that. So thank you for clarifying that.
yeah, yeah.
Yeah. The one word you kept using throughout the show is modifiable, and I love that because it's not like
Mhm.
we are doomed because we are South Asian, right? There's things
Right,
that we can do, and there's all these things we can do that are in our control.
exactly.
And,
Yes.
and oftentimes with cancer, like when you get cancer, you feel like you're losing control, but there are so many things we can do. And we,
Totally. And like even for myself, I have a
yeah,
very high lipoprotein small a.
yeah.
I went to a preventive cardiologist who was able to get my LDL level under 50. In fact,
Okay.
it's 31.
So
Um,
can you also decrease your LP little a? Like, can that go
that's a
down?
good question. I think there
Yeah.
will be some medications in the near future
Okay.
that will allow
Okay.
you to do that. But at this point, no.
No.
Even
Okay.
exercise or diet does not change it.
Oh, wow.
People have tried things like niacin,
Right.
all of this. The best thing is to just control your lipids. Basically, if you can get your LDL down below or apoprotein B levels, down below a certain level,
Okay.
that's the key way to do it. And you probably have to take medications,
Okay.
especially if you've had an event.
So do you want LDL below 100? Is that the number you're looking for or below
So it's, if someone's at higher risk, it probably has to be under 70, and it
70?
could even need to be like, and depending on, it could be under 50 or 55.
Okay.
But yeah, so those are the,
Mine is like 100, I think, which is not probably good. And the total cholesterol is normal. Do you look at the total cholesterol or not? You're just looking at
it's good to get it, but it's more important test is the apoprotein
the
B.
apoprotein B. Okay.
Yeah, that's actually much more accurate. It's sort of
Okay.
almost like a all-in-one test that you can get.
Okay.
I mean, not that you shouldn't get all the other tests, but I mean, this is a
Yeah.
very strong correlator with,
Yeah.
what's really going on in our bodies
Okay.
the, from the lipid perspective.
Okay. Could you repeat the labs that South Asians should ask their doctors just so that
Yes,
they have them all in one place?
yeah, definitely. So I would say hemoglobin. Okay, first of all, you should be getting your blood pressure checked. A lot of people don't
Yeah.
realize this, but that
Yeah.
can start early.
Right.
I mean, I would say if you're in your late teens or 20s, early 20s, you should start getting your blood pressure checked routinely. Um,
Yeah.
and it should be under 120 over 80. If it's 120 over 80 or higher, it's actually abnormal, surprisingly.
Oh, wow.
Um, yep. And then this is, based on the American Heart Association's recommendations. Number two, check your hemoglobin A1C, your fasting glucose, and also your fasting insulin to check for early insulin resistance. Number three, check your lipids. That could include triglyceride level, HDL, and also apolipoprotein B,
Okay.
particularly for South Asians. Get your lipoprotein small a checked. And I would say test for C-reactive protein, high sensitivity
Okay.
C-reactive protein. And the other test would be for early liver disease, fatty liver in particular, to get your liver function tested. Um, and trying to think of anything else. Of course, if you're at, you should get your screening. There's a coronary, there's certain equations that you can test your
Yeah.
profile, your cardiovascular risk profile, or ASCVD or atherosclerotic cardiovascular risk profile. It's there's a te it's a calculator
Is
actually. It's
that
a risk
is
calculator.
that a website people can go to for
Yeah,
that?
so people can
Okay.
go to this. There's the Prevent website that may be
Prevent.
pretty helpful. It's
Okay.
Prevent. It's you
Okay.
basically plug in your numbers
Okay.
into this website, and it's through the American Heart Association / American College of Cardiology,
Okay.
and you can use that. And there's also even the United Kingdom has an even better risk calculator called the UK Risk 3, which
Okay.
accounts for South Asian heritage, by the way, or ethnicity.
Oh, that's good. Okay. Okay.
And you can check that. And if your score is, you know, in the intermediate borderline to intermediate range,
Okay.
you should consider getting a calcium score.
Hmm.
If you're relatively young, perhaps even a CT coronary angiogram, especially if you have a strong family history or are having symptoms.
Okay.
Yeah,
That's all great information, Dr. Syed. Such a great information. Thank you so much.
you're so welcome. My
You
pleasure.
you have been amazing, and so thank you again. We've heard South Asians face higher rates of diabetes and heart disease, often a decade earlier than any other groups. We've learned so much from this podcast. I'm so grateful to you, Dr. Syed.
And
And
I would say one more thing. I would say
yeah,
if you're at all interested in the history of perhaps how our health problems arose, I did try to write a book about the impact of epigenetics and the unique history of the colonial famines that were so devastating and catastrophic.
where can one get this book? I already got mine, but where can one get this book?
Yeah, so you can get it off of Amazon.
Yeah,
Actually, I believe most of the major booksellers carry it. And you can also, of course, go to BookBaby, which is the publisher.
yeah,
But by major book publishers, I'm talking about Barnes and Noble,
yeah.
uh, besides Amazon, Books a Million, and I think there's various others booksellers that
It's a
carry
very good book. I got it on Kindle because I don't have the patience to wait. So
it.
it was
Yeah,
really
there's
good.
an ebook and there's also a hard copy book or
Yeah.
soft. Yeah,
How long did it take you to write the book? I was thinking it must have taken you years to do that, write that book.
yeah, it actually did. I mean, I wrote most of it during COVID, actually, when
Did you?
things were,
Okay. Yeah.
there was a lot of changes.
Yeah.
I ended up having some time on my hands,
Yeah.
and it sort of, as I took the deep dive, it was just so eye-opening. I felt like people needed to understand what happened to
Yeah.
us as a people during colonialism.
Yeah.
A lot of
Yeah.
people don't realize this, but South Asia was the most wealthiest region on earth.
Yeah. I did not know that. I know you.
25 to 27% of the world's GDP before colonialism.
Yeah.
We South Asians were, huge in manufacturing, textiles, steel making. The quality of the steel was amazing. Leaders in so many areas. They had public education, leaders in science and technology, um, and a lot of our words for clothing comes from South Asia for a reason. Words
Yeah.
like wool, cotton,
Right.
dungarees,
Yeah.
you name it. There's so many words because they were a leader in making clothing for the world.
Yeah. Yeah.
Um, and shipbuilding, even surprisingly,
Yeah.
the quality ships were made in South Asia.
Yeah.
But it was like 25% of the world's GDP. And then after colonialism or during colonialism, it was South Asia was deindustrialized, vast amounts of wealth. It's estimated $66 trillion of wealth was systematically eliminated or removed and transferred to Great Britain in the 200-year period. That's actually an understatement because there's probably even other forms of wealth that were taken that aren't accounted for. But that's just based on the foreign exchange, by the way,
Yeah. Yeah. Wow.
that was collected. So South Asia didn't collect any of its foreign exchange
Yeah.
for for the value of its exports.
Wow.
All of that was, even though South Asia was the second leading exporter in the world after the United States,
Yeah.
the huge value of this wealth that could have been helped develop South Asia
Yeah.
instead transferred to Great Britain
Oh, wow.
for, hundreds of
For
years.
hundreds of years. Yeah. Yeah. There's so much, I don't know. Is this talked about
And
in history
25
books?
major famines that, I mean,
Yeah.
it's estimated there's a economic historian, Jason Hickel, who did some research on this. Between 1880 and 1920 alone, tw 100 million to 165 million excess deaths
Oh,
when there was
wow.
enough food available for everyone because
Yeah.
food was systematically exported even during
Exported.
the famines.
Mm.
Life expectancy was dropping under colonial rule.
Yeah.
So these huge famines were very devastating and I believe have long-term consequences to our health.
Yeah. For generations to come, unfortunately.
Yeah.
But thank you for enlightening us and educating us. I think this is such great information and knowledge, and this will be so valuable for so many people, not just South Asians, but anyone listening to this podcast. You give so many good pearls and wisdom and laps they should be asking their physicians for. And what does Dr. Syed do in a week for working out? I'm also curious to know that. So,
I try to go for at least 30 minutes twice a week. Um, I go to a trainer and I do exercise,
okay,
continuously for the 30 minutes.
okay,
And I also try to walk at least 10,000 steps every day,
every day. Okay,
um, as much as I can. Of course, sometimes I can't, but it's my goal and I try to exceed it if I can as well.
yeah, wow,
And or if I can't walk, I'll try climbing stairs,
yeah,
especially after dinner, or like we talked about those resistance exercises that you can
yeah.
do relatively quickly.
Yeah, yeah, awesome. So we talked about your book, and people can find the book on Amazon and other places. You're very active and at Daisy
Yes,
Doc,
Daisy Doc.
Daisy
Yep.
Doc.
Instagram and
Instagram.
mostly is Instagram. I do
Okay.
have a TikTok page as well.
Okay. Do you post on TikTok very often or not?
Not as much as on
Yeah.
Instagram, actually.
Okay, I know. I think Instagram is where people are, most of
Right.
them. Yeah, TikTok is
Mhm.
much younger generation. So, thank you again, Dr. Syed. I know you've
Thank
had
you.
a
My
long
pleasure.
day. Yeah, this has been great episode, and I couldn't help my mom, but my hope is that other people can help their moms, their husbands, their fathers, sisters, brothers, and so you have given us so many good pearls. And I love the word modifiable. We are not doomed. We can do things to help ourselves to decrease the
Right.
risk of developing cardiovascular disease. And thank you so much. I'm going to put all the links to your book and to your Instagram page.
Thank you so
And
much. Really
yeah,
appreciate it.
I really, really appreciate you taking time. I know as a physician, you're busy, and you would have made a difference in at least 147 countries. That's where this podcast reaches. So
Thanks. That's amazing, really.
thank you so much. Thank you.
Thank you for what you're doing. You're
Thank
doing
you.
amazing work here
I
with
appreciate
this.
that. Thank you so much. Thank you. Thank you, everyone, for tuning into the Breast Cancer Podcast. Remember, you're not alone in this fight. I encourage you to be an active part of this podcast. Please share your stories, questions, and suggestions for future topics at my website called drddeepahalaharvi.com. And please share this podcast with others, especially if you found it useful. And please also give it a 5-star rating, if you will. Stay connected as we navigate the complexities of breast cancer. Until next time, take care and keep shining brightly. Disclaimer: this podcast is not intended for complete medical advice, so please talk to your medical professionals.